Ohio Department of Health reports 2,500 of our state's residents died of drug overdoses in 2014, and the heroin problem is so bad in Ohio that the Centers for Disease Control has come to this state to study it. This week, the CDC is basing itself in Columbus, but is studying Portsmouth, Dayton, Cincinnati, and Cleveland. NBC4's Mike Bowersock shows us what the CDC hopes to learn and talks to a recovering addict who knows too well the dangers of the drug.
Kyle Pennington says he knows at least 50 people who have died from a heroin overdose. He's 29. He's a recovering addict, and he lives in Marion, the city that had 56 overdoses and 5 deaths in just a few months this year.
I had friends die, and the first thought in my head is not, oh, my friends are dead. It's, where'd they get that stuff at? I mean, it takes a hold of it, and you just don't care.
It's insanity.
Yeah, it is. I mean, you just don't care if it kills you or not.
It is that intense attraction to a drug that could easily kill someone that has brought the Centers for Disease Control to Ohio this week. There is a team of 7 people interviewing addicts, researching data, and following up with coroners and reports from the morgues to try to come up with more information to fight this heroin crisis. Particularly, the CDC is interested in fentanyl-related deaths, the synthetic drug that is often mixed with heroin to make it up to 50 times more potent.
We're looking at it from a couple of different perspectives. One is to really do a deep understanding of the fentanyl situation. So then we can target prevention messages appropriately so that we can really help people understand how serious it is and how to avoid it. And then the other thing we're looking at is how can we detect these problems sooner.
Fentanyl can be used as a pain reliever for cancer sufferers. When mixed with heroin and sold on the streets, it's a killer. This week, it's the subject of a national study being conducted in Ohio.
They come in for public health emergencies or situations that we need to address, and they were happy to assist us on this because they realized that although, we have a significant problem here, other states do as well.
In fact, it is the fentanyl in the heroin that is believed responsible for most of the deaths. It is also called blue drop heroin, and you may recall from this past spring, blue drop heroin was responsible for the overdoses in Marion. In just a 12-day period, there were 30 overdoses. I'm Mike Bowersock, NBC4.